urgently, the committee want me to show my video about something. So I select thread lifting. This is the one case. Yeah, so I tried the face and temporal thread lifting. There are many techniques to do the thread lifting for the face. So this time I will show my personal technique. You can realize my a little different technique, especially when we do the thread lifting in the patient who had the bigger, wide mid face. So after thread lifting, just for just the middle and the low part, sometimes we can see the mid face widening. So I developed how to develop the technique to prevent the mid face widening. Also, we can reduce the mid face widening by fat grafting. So under the propofol sedation, I'm injecting the tumescent infiltration. So my technique has 2 or 3 steps for thread lifting. It means the first one step means the thread insertion from the this temporal hairline to the low and mid face. Second step is to lift the temporal region. So insertion starts on the middle of temporal, from the middle of temporal and pass the first entry site, the pass and the lower than 2 or 3 centimeter lower. So this is the second step insertion. So now I'm making the entry site for thread insertion. So interval of this entry site 2 or 3 milliliter. I don't use 1 or 2. So I used each entry site for thread insertion. So and I'm in insertion that inserting the thread. So basic is the same as you do. So from the upper level of the zygomatic arch and body, the thread placed above the SMAS and below the zygomatic bone, the cannula should be inserted into the SMAS. Distal end, the thread would be the middle or lower part of the SMAS. So each entry site, each thread, one and one. This is my the lifting technique to insert the thread in the first step. So, and then now you can see the design. So for the lower, the 1, 2, 3, 4, 5. Usually I put the thread for lower and low face 5, mid face 2 or 3. So when I use when I do the low face lifting, and I use the 10 millimeter, 10 centimeter length thread I usually use. And for the mid face, I use the 6 to 7 centimeter length thread I always use. So combined together. So my my target is for the low and mid face is to make this plane, and not individual thread lifting, but I'm making the plane of plane like this, whole plane of soft tissue. And then here I'm making the entry site for the temporal lifting. So puncture with 18 gauge needle, 5 to 6 entry site are necessary. So I use in this the second step, I do the deep temporal lift. I use the double dual layer thread lifting. So from the temporal region, now touch the deep temporal fascia and come out again into superficial level and go into the deep level again. So this is the deep placement of a thread. Each 5 to 6 entry sites I use the 5 to 6, 6 threads. So, and I put the thread into the deep level. Deep level means lift the deep temporal pressure. The thread should be under the temporal pressure, under the superficial temporal pressure. So I'm insert spiral core period thread, and then penetrate the superficial temporal pressure and place in the space between the superficial and deep, and then go into pass through the superficial temporal pressure, and the low part of the thread should be placed under the superficial temporal pressure. And then using the same entry side, I put. So in these tabs, I use 2 threads in one entry side. The penetrate the superficial temporal pressure, and then come again into superficial level and placed in the superficial plane. So this is the same. This is the superficial temporal lift. So usually I use I use 10 to 12 thread for the temporal lifting. So generally, when we just do the first step, usually post-step thread lifting, when we use the bi-directional cork thread, you can make the, can you see here? Compress the right side thread lift, left side. The contour, the mid-face contour here is the width of the mid-face and reduced here. The flattening round, and this is the plating. So push down the soft tissue, you can see the different wrinkle texture. So, and then you can see the right side, the other side, and make the entry side, each entry side. So the thread is 1, 2, 3, 4, 5, 6. And then insert the thread, the superficial layer, so penetrate the skin, and place above the superficial temporal pressure, and passing the zygomatic bone, the cannula should be inserted into the mass. So same technique you can do. The entry, each thread has their own entry site, and then when you control the depth of thread, you can see by my right hand, but you can see by left hand. When you want to put your thread into the deep mass, you should use. You shouldn't. No need to change angle of cannula here, but you can see my left finger lift up, push up the low part of soft tissue toward the entry side like this, and fix and lift it. So now I'm inserting the thread for the mid-face lift. So you can see not right hand but left hand. Left hand's assist is very important. So here you may have experience to push place the thread into this area, but sometimes you have some difficulty to thread into the deep plane. So at the time you can use not right hand but left hand, so you can control the depth of thread. And this, you can see the change of angle of the needle. And you can see now is the deep temporal lift, and vertically penetrate the superficial temporal pressure, and then place the deep, and then up again, come out again into the superficial level, and then penetrate superficial temporal pressure again, and then placed into the deep. So, and this is the deep temporal lifting by using the PyMed PD thread. So here, below this level here, we can lift the deep temporal part, the deep part of soft tissue. So we can actually, after one step, around the first entry site, we can see the increase of volume. So using this technique, you can reduce this part of volume. So I'm placed the thread superficially now, So here, the same entry site, we can use the two thread. One is deep lifting, second is superficial lifting. So after this the dual plane lifting, you can see the volume reduction from the lateral part of a midface. Now is jaw lifting. Jaw here is the mandibular ligament, the strong ligament supporting. So here is the legs area, weakest area in the face. So even we lift from the middle and low face, the low part of the jaw here at the laxity still exists. So because this part of the skin and all tissue, they have less collagen part, collagen fiber, elastic fiber, much more. So the jaw sagging too. Jaw sagging is combined with the lax of SMAS muscle, the platysma muscle too. So we need to tighten. We need to tighten the SMAS muscle. We need to tighten the SMAS muscle, and then we need to reduce the volume of jaw from here. So when you use this technique, we can move the deep part of the soft tissue, jaw fat, move to lateral wall, and tighten to the SMAS muscle, the platysma muscle too. So this thread is support the previous first step lifting, and then second is the tightening of the blood lower the neck, lower neck and jaw line. And now is the volumizing thread insertion. So usually when in the concept of thread lifting, when you use the PGO thread, those thread is just used for the thread lifting, lift for face. But for the other areas, the volume defect area, we just use the filler or fat. But the PIMBM or the other the PIMBM company developed the cylindrical mesh type thread. So cylindrical mesh type thread, when you insert into the dead space, the surrounding soft tissue migrate inside this thread. So they grew inside and make a volume. So this is the very mobile area. The fold middle line is when mobile area, when you're talking, chewing and eating, very mobile while smiling. So when we inject the filler here, sometimes the filler migrate into the lateral or low part of the other area. So when you insert the cylindrical mesh type of thread here for volume defect, and then they last much more than filler. Sometimes we can combine the filler. And this is for the subdermal insertion of very fine, smooth thread, because this is also a movable area, so skin also be thin. So we need to increase the skin thickness. So we can put a very fine thread for the skin thickening or skin tightening together. So for the deep, we can put the cylindrical, the mesh type of a thick thread for the dead space improvement, and the second is fine thread for the skin tightening. So, and I actually this my urgent the presentation. I didn't prepare anything. When I finished edit, I just saw this video first time. So I didn't prepare the before and after photo too. So so please understand this urgent my presentation. So when I marking for the planning, I mark the deepest area, and then I put the thread, the thick thread, the mesh type of cylindrical mesh type thread. Each size I usually use 3 to 5 number of thread I used to cover the dead space. So in this case, I push back again, and then we can put into the dead space. And I use the fine thread like this subdermal insertion. You can see the subdermal thread insertion. Now you can see. So here you can touch. You can touch your finger at the skin, and you can see the thickness, the differences of thickness. So even not only in the deep space, but even in the skin, you can realize the very thin skin. So just lifting is not only solution. So we do the lifting, and then we should cover the dead space and the skin thinning too. So most of the doctor, they use the Botox and filler together, but I just use only thread for the lifting and for the dead space improvement and for the skin texture together. So there are many kind of thread. The thread has manufactured, produced by the different purposes. So we can use it all to improve the aging or to improve on the development, the status of face. Here also, mostly we use the filler, but sometimes the patient who had much smiling, frequent smiling patient, when you inject the filler very easy to migrate the other parts of the face. But I have some experience to put this cylindrical mesh type thick thread to recover, to restoration of volume defect in the Indian fold. So after insertion, patient feels some fullness like a filler, but a little hard feeling of sense. The patient talked to me. So after insertion of at least 5 to sometimes 10, 11 thread, a patient gets very much satisfied with the volume augmentation. So I didn't didn't use any filler. But sometimes the patient has a very thin skin in the middle line. The skin also be thinned, so I inject the combine after healing at least 2 weeks after. I can use the filler injection for the skin thickening. So this is a thick cannula. So I used just only one entry site. So sometimes patients have complained of this around the depressive scar. So I recommend to use not only one entry site, but over 2 or 3. The 2 entry sites is much better to prevent skin problems. So, and do not use the one entry site. I'm touching. So this is the design here. This is the thread insertion area, not insertion area, where before you can touch, and just after you can touch the thickness of soft tissue after a thread insertion. So almost the same thickness. So you can feel the almost same thickness from the here. This is the end point of thread insertion. So you can stop the insertion more. You can control the number of the thread from your finger feeling after touching. So you can see I don't want to recommend only use one entry site, 2 or 3. It's no problem. Divide 2 or 3, please. So especially the patient has the oily and thick and oily skin patient do not use. You should use 2 or 3, at least 3, because the oily and thick skin get much scar. Okay, a very easy technique. So when you insert thread, you should touch the maxillary bone first. Place the thread under the maxillary bone, and then at least 3, and then 3 or 4, and then you can insert the thread under the muscle, the middle deep fat layer, and finally you can under the skin. So the defect at cross-section view of this part of dead space is not a square, not triangle, but actually you can imagine the dead space inside. So you can control the number, and you can control the level of thread insertion. So and then this is the natural fold. After this, and you can feel the feeling of a sense from your fingertip, you can touching by touching the nasal fold area. So most of the patient don't have the same thickness. So here this area look thinner than this. So or this lateral fold is actually after the skin deep part of the soft tissue volume defect much more than left side. So in this case, you can check the before surgery. Let the patient smiling. You can see the different extension, different the figure of the smile. So this actually before surgery she used much more smiling action animation on the right side than the left side. So they use much on each side. That side the volume much volume the decrease much. More large decrease much than the other side. So right side she had a thin lateral fold and the cheek area. So I put the cylindrical mesh type of thread for volume restoration, and like this, and then touching the compare the both sides the skin thickness by your from the feeling of your fingertip, and then you can decide the entry you can decide the number, or you can decide the level of thread insertion too. And then touch again, and then now is this side not only deep the soft tissue but also the skin. The skin thick is different, so we should put a very fine thread for the skin tightening and the skin thickening too. So I'm insert the thread under the dermis. So and push the skin and push and pull the thread a little more than 0.5 centimeter. You can cut the thread. Cut the thread a bit carefully, and when you're cutting the thread, you should check the any hair incorporate into this entry site. Sometimes the thread has cork. Sometimes like this, just people like this. Sometimes the hair the insert into the tissue of the forehead tissue together with the thread. So just after. So you can, I guess, just before and marking, and just after surgery, you can see the change of the facial contour and volume, and the entry site after sterilization, and then close with the tapping. And the tapping is important to reduce the swelling, reduce the facial animation, reduce the further bleeding. So the 3M tapping, it lasts at least 2 or 3 days. So the patient who has allergy, at least attached to the at least 2 days after, let the patient remove themselves. That is the 3M taping. And this entry site, the opening is closed at least after 2 or 3 days after. So, and patient come again and checking. Otherwise, let the patient remove the tape. Okay, sorry. This is urgent, my video, so I didn't prepare the perfect my video presentation because of the urgent.
Thank you so much, Dr.
So
Savikant. We have about 10 minutes left. So I have, I think, many questions.
Really? Oh, that's great.
What about the mesh thread you use for increase the volume? What kind of the threads, what the component and ingredient is PDO thread?
Yeah. The PDO thread is the mesh type and the cylindrical shape. So like a tube. So inside there are hole, inside there is space. So when you put the thread into the tissue, our cell, connective tissue cell migrate into the inside the thread. It thread lumen, so we can increase the volume. So that's
the the pore, the hole inside.
Yeah.
So the
There's a
tissue
kind
can flow.
of very thin cylindrical tube made by PDO.
PDO.
Yeah,
Which area can use this volume thread in on?
This volume thread we can use all area of the face. Sometimes I use for the brow augmentation, and the nose augmentation, and any place to want to increase the volume. Otherwise, when I use for the diagma, so when we put the thread into just above the periosteum, we can increase the volume of the something like the volume of the bone.
What number of the gauge of this volume thread? What number?
Yeah. For example, when we insert the thread for the Indian fold, the mid-cheek puro, and we usually mark the depressed area, right? Otherwise, we can insert the thread into the nadir fold or the medial line. During the marking, we can touch the soft tissue thickness, and we can mark the depressed area, right? And then we can touch the insertion area, not insertion area, right? So we know that we know the status of thickness. So we should consider the number of the thread, right? So the number of thread is also important, but more important thing is the level of thread insertion. So like a filler or fat injection of my technique, it's much better to insert the thread into the deep area. So when the facial area, they have a bone, you should place the thread just above the bone. And then the middle level and the superficial level, like a pyramid, something like that. So during the insertion, you can touch the area, not planed, the other obtuse area you can touch, and then insertion area touch, non-insertion area touch. So before you can touch, you can feel the difference of thickness, but by inserting the thread, you can realize the change of thickness, the area inserted by thread. So this area, almost the same thickness you can feel from your fingertip. You should stop. Usually, for the mid-cheek furrow, from my personal experience, at least 5 to 10, sometimes 12. One side is enough.
Okay, it's a new mesh thread that launched in Korea.
Yeah. The company name is Pine Med. Pine tree med.
Very innovative products from Korea. Another question, talk about the temporal lift. You put the thread into the superficial temporal fascia.
Yeah.
You say up and down. All right. First,
right. I did my technique is dual plane lifting for the temporal area. So actually, when you touched your temporal region, they're very sleepy and laxity, right? That area, the superficial temporal fascia, is thinner than the other's mass. So much laxity together with volume defect all the time. We get with aging, we lost our the temporalis muscle volume and the subcutaneous fat. Everything is the volume is decreased and the structure inside attenuated. So even we lift by thread lifting for the mid and low face. We fix the upper part of thread into the strong part of the ligament, near the temporal region. Actually, in the supine position, when you do the operation, the lifting is very nice, but in the standing position, some total part of the face volume can be moved downward. That is caused by temporal laxity. So my Second one is when we insert middle and low pace by tread lifting, you can realize, you can see, sometimes not obvious but most of the case you can see the change of the mid phase lateral contour. Most of the case, the fixation, upper part of tread, the fixation is not steady, not fixed, movable. The floating type, you can see the mid phase contour would be widened much more than before. So that's another complication side effect. So to prevent these two, I used the double plane tread lifting. So my plan is I used 5 to 6 entry point. In each point, I used two tread. One is for deep lifting, second is superficial lifting. So when you penetrate the skin, scalp, and you should penetrate superficial temporal fascia and at first, and then placed a little in the between superficial and deep temporal fascia, and come out again above the superficial temporal fascia, and then again going back to the space between deep and superficial temporal fascia, and low part of tread should be placed inside the SMAS. But this is the plan.
Similarly, to make a wave corrugate for the superficial temporal fascia, right? Because you make a thread up and down between the superficial temporal fascia. Okay.
And then, second one is the same, upper part the same. Penetrate the superficial temporal fascia, come out again under the skin, and then placed the superficial temporal fascia above the superficial temporal fascia. This is superficial lifting. So one entry site, one entry site we used two thread, and the deep plan and superficial plan. So we can lift the whole pace, and we can change the mid pace volume by these two thread lifting.
Okay, thank you so much. You can finish in time. Okay, so now I would like to close this session.
Sorry.
Thank you for Dr. Safikang to make an urgent lecture for this amazing conference. Okay.
Thank you. See you at 4 p.m.
Lecture on about 4 p.m. Thailand times.
Okay.
Thank you so much.
Okay. Bye. My pleasure.
Now the next is for the lunch break. We will start and come back again about 12:40. Okay. See you at that time. Have a nice lunch.